our operation room. And what's important is a gentle aspiration is when you have yellow fat. Yellow fat aspiration means no blood vessels injured, and in opposite to more aggressive techniques where this all is red. And you also see the fat swims up. Here we have the tumescent solution, and to compare the volumes, we have to talk about this volume, not the whole which is in the bag. And by the tumescence technique, it's possible to infiltrate up to 11 liters, and we have up to 8 liters aspirate. And this is safely possible. Finally, we covered with these bandages, no suture, because we use at the open drainage. And very important, the compression garments after. And this is a typical finding next day, just very little bruising. And that's not, it's always that way. No hematomas. That is the proof for tissue sparing technique. Here also a video. 1 day after liposuction of the lower legs, no edema. Skin is soft, no hematoma. That's state of the art of liposuction, for my opinion. Well, there are 2 techniques in Germany allowed to do for lipedema. It's a power-assisted liposuction, the PAL technique. I prefer, and I showed you, we have here the studies about effectivity for lipedema. And the other technique is a water jet assisted liposuction. It's familiar, but there is a water at the tip of the cannula, which spills out the fat cells. The post-operative treatment is as important as the operation itself. That means we recommend manual lymphatic drainage for 3 weeks, 2 or 3 times a week, and compression for at least 4 weeks, even longer as necessary. What means necessary? It means a patient should wear compression as long as there is a postoperative edema. It can be weeks, it can be months, it can be years. It depends on the age, the stage, and obesity. We have a huge range of lipedema patients. We have the young ones, stage 1, and older with stage 3 and obesity, and they all need a different concept and an individual concept. And this concept I showed you was a result of an international conference in Vienna in June 2017, and this is a paper. 40 experts from Europe met and wrote this consensus. Well, what about the results after liposuction? This is a questionnaire we use for our first study. We have the visual analog scale for pain, for example, and we saw that it goes down from 8 to almost 0. And that's the main aim of liposuction. We perform a pain therapy. And here are some results. Well, young women are perfect. There's a good skin retraction, and we have good cosmetic results. In elderly patients, that's more difficult. Retraction techniques as laser or argon plasma can be performed, but this is additional, this is cosmetic. Just some example. Here you see just lipedema of the lower legs, but 8 on the pain scale, and that that means there is no correlation between the stage and the complaints. Patient in stage, she has sometimes more pain than a patient in stage 3. Here, after liposuction of the legs, and you see another effect. Her trunk is slim. She lost weight because she did more sports, more better quality of life, and then it was easier for her to lose weight. This is lymphedema. We diagnose when you see here the positive stemmer sign and edema of the feet. It's also possible to use the technique, but we have a dermatosclerosis. That means fat changes to connective tissue, and that's more difficult to aspirate. The aim here was to give her just back mobility. And we have long-term results by Wilfried Schmeller for 8 years. And when we look at the pain, it goes down, then it slightly goes up. That's why there are still lipedema cells remain. We cannot defat. That's impossible. And that's also not necessary. But these lipedema cells still behave like lipedema cells. So this explains the slight recurrence, but it never reached the level before. Well, we have a new guideline in Germany. The first was published 2005. We have since 4 weeks, a new one is published. And the guideline confirms the criteria for diagnosis. These are disproportion, pain. This is a main criteria. Yeah, lipedema without pain is not lipedema, or then we call it lipohypotrophia. Well, the beginning with hormonal changes in a woman's lifetime, puberty, pregnancy, and menopause. These are critical trigger factors. And now the discussion about edema. Well, we we when we press our thumb into the lower leg and there is a pitting, a hole, that's a proof for edema. And on the left side, there the tissue is soft. There's no edema. And that can be in early stages in the morning, but during the daytime and summer, in the evening, there is more and more edema visible. So in this case, there should be made a decongestive therapy. Well, in 70%, the arms are involved, and we have different types. And that's a family that shows the genetic predisposition. And to differentiate to lymphedema is easy because just look the stemmer sign and look at the feet. And the lymphatic system is in lipedema patients normal. That's not the problem. Well, that are the stages. It shows also the progress, which cannot be individually predicted. But it's also important that these stages are just considering the silhouette, not the complaints. So in our new German guideline, we recommend to use to not use this staging anymore. We are looking for a more objective um, um, uh, scale for naming the complaints. It's very often in combination with obesity that nothing to do with each other, but it has a negative influence. So the recommendation is first losing weight, look what's left, and then liposuction. And of course, we prefer perform liposuction in normal weight than in overweight patients. Even by bariatric interventions. And the BMI is not fair for lipedema patients because it includes the lipedema fat, which can be influenced by patient. So our guideline recommends the waist to height ratio um, for decide is it more obesity or more lipedema. And we developed a holistic concept based on 6 columns. First column means nutrition. We recommend ketogenetic and Mediterranean nutrition. So high protein, low carb is the concept. For sport, we recommend sport in water because we use the advantage is the sport should be vertically because we have here high pressure, which goes less to the surface. So we have a lymphatic drainage effect. We burn calories 3 times effective than any other sports, and we have um, not the body weight on the ankles. Compression and manual lymphatic drainage. There is an indication when edema is proven by pitting. So first try to treat by compression. If this doesn't work, we recommend additional manual lymphatic drainage. So compression MLD first is edema therapy, and the second, it can be pain therapy, but not for every patient. That should be a trial. It's 50-50. Some say pain is better, some say pain gets worse. So in the last case, there's no motivation for using it. Well, we have the compression and a bandage, and it's new, this manual adaptive compression for elderly patients. And also the intermittent pneumatic compression, Lymphomat, or I think in the US it's FlexiTouch. We recommend also for by the German guideline. But it's important to instruct the patient how to do first manual lymphatic herself to open the lymphatic flow before she slips into the manchette. Well, by the fat pads, we also see orthopedic problems by the X position of the leg. And the last column means psychologic aspects. Young patients suffer sometimes from eating disorders, elderly patients from depression, and our guideline recommends professional support in these cases. And well, when do we do liposuction? I have some patients with 17 years old. This is one example. She had pain, she has psychotherapy, and you can imagine for a young woman what means to have heavy and big legs. And after she was a different person. This is my eldest patient, 76. As long as patient is healthy, it's possible to do the liposuction under tumescent, and because it's very safe. Well, we have in our practice, we see 3 problems. Documentation in our daily work in the office, it's time consuming. The stages are not representing the real complaints. And many patients wait years, sometimes decades, before they get a diagnosis. That's why I developed with my daughters, their IT specialist, we developed an app. It's called Lipo-Check. We have the support by the German government. The idea is every woman has a smartphone and she can make two photos, answer a questionnaire, and by AI, which is trained with the data of 3,500 patients of mine, it puts out lipid. Uh, is it lipedema or not? Or is it suspicious for lipedema? It You get the measures of the leg, shows the areas, and gives a lip Q, which is an objective um, parameter for the complaints. And well, the app can do the diagnostic documentation. It can give recommendations for treatment, guideline conform recommendations, of course. As I'm a member of the guideline, I am one-to-one put it in the app. And we also provide knowledge about recent studies and so on. And my plan is also to integrate a tutorial for doctors. And the patient has the app on the smartphone, and it can be transferred to the dashboard, which is in the IT system of the doctor. So he needs less time for all the documentation and gets guideline um, con, um, um, confirmed recommendations for treatment. Finally, I thank for all great visitors from all over the world. I'm allowed to share my experience with them, and I think everyone is invited for hospitation. And it's always a pleasure to share our experience, and we can always learn from each other. Thank you so far.
Thank you very much. That was awesome. Thank you. I really appreciate you sharing that.